Hey guys, a very good morning to one and all. Myself, Krishna Kothari, consulting dietitian and diabetic educator, holding a master's degree in food science and nutrition and having 10 years of experience. We are here to talk about a very relevant topic, that is PCOS. First of all, my sincere thanks to the entire team of UN Mehta Hospital and Ms. Poonam Brahmbad for having me on board for sharing my insights on this most important topic of today's era. PCOS is one of the major public health concern these days and one of the most common hormonal disturbances that usually happens during the reproductive age. Let's learn or let's understand how the nutritional strategy and lifestyle changes or modifications can really help you come out of PCOS and lead a very happy and happening life. First of all, let us understand what is PCOS. PCOS is polycystic ovary syndrome. It's a complex endocrine disorder. It's a heterogeneous disorder which is defined by combination of various signs and symptoms of androgen excess. Androgen is the male sex hormone and ovarian dysfunction with lot of clinical manifestations of oligomenorrhea, subfertility, hirsutism, acne, and it affects mostly 1 in 15 reproductive age women worldwide. Basically, what does oligomenorrhea means? It's the type of abnormal menstruation that involves the infrequent periods. So once you get your periods, then the later on your 28-day cycle doesn't come at the right time, and then your periods get disturbed. It was first described in 1935 by the American gynecologist Edwin F. Stein and Michael L. Levington. The various features of PCOS are multiple small cysts that happen with the thickened tunica albuginea and hyperplasia of theca cells. The name PCOS describes numerous small cysts, means small fluid-like sacs that develop on your normal ovaries. There are various names of PCOS, that is polycystic ovary disease, Stein-Levington syndrome, functional ovarian hyperandrogenism, means the overproduction of the male sex hormones, ovarian hyperthecosis, and a lot to add. Although a majority of the cases with PCOS are either overweight or obese, a small but significant proportion of the patients present with the normal BMI that makes the diagnostic workup more difficult, as I told about lean PCOS. Now let's understand how a normal ovary look like and a PCOS ovary looks like. So here is a picture which represents the normal ovary versus the one with the PCOS. So we can clearly see that in the normal ovary, there are different structures which are already placed in its place, and in the PCOS we can see the small ovarian cysts that are formed inside of the ovaries, which ultimately leads to the abnormal production of more androgens, which creates a lot of problem. So usually the polycystic ovaries are larger than the normal ovaries because of the formation of the cysts. Let's understand the PCOS symptoms. There are various symptoms. Not only just the irregular periods can be one of the symptoms of PCOS, but multiple symptoms are associated with each other. For example, hair loss, male-like baldness, hirsutism, which is unwanted male-like pattern of hair growth on the face, chest, as well as back, pelvic pain, infertility, overweight, irregular periods, getting easily, fatigue or lethargy, acne, and high testosterone levels. If we talk about the signs and symptoms in a little more detail, then we could see that the signs and symptoms are divided according to the age. For example, if we talk about the reproductive changes that takes place during the prenatal period or during the teenage time, then there is premature adrenarche or early menarche. That means a girl child gets early periods. If we talk about in the adolescence, menstrual irregularity, acne, hirsutism, infertility, miscarriages, pregnancy complications, and the endometrial cancer. And if we talk about at the menopausal age, it might possible that delayed menopause is there. Now, if we talk about the metabolic changes that usually happens, so in prenatal, we can talk about the abnormal fetal growth that happens due to PCOS. If we talk about the reproductive age or the adolescence age, obesity is very common, impaired glucose tolerance, dyslipidemia or type 2 diabetes. Same goes for the post-menopausal period wherein obesity, impaired glucose tolerance, insulin resistance, dyslipidemia, type 2 DM, those are very common. And if we talk about some other aspects, some other signs and symptoms which usually happens at the various age would include fatty liver, anxiety, depression, sleep apnea, disturbed sleep, and cardiovascular diseases. Now, if we talk about the complications that happens due to PCOS, there are n number of complications that happens due to PCOS, starting with the one most common, that's type 2 diabetes. This usually happens because of the insulin resistance that usually happens in PCOS. Then there is high blood pressure. Due to high blood pressure, there are various heart or blood vessels related problems. So there are chances of a person getting cardiovascular diseases, uterine cancers, sleep apnea, which is a potentially very serious sleep disorders in which usually the breathing repeatedly stops and starts again. And depression and anxiety, this is basically happening due to lot of hormonal changes that happens in PCOS. A lot of mood swings that happens due to hormonal imbalance or the changes in the hormones that a girl or a woman goes through. Now let us understand one of the most important topic or one of the most important concept of PCOS, that is insulin resistance. Insulin resistance is when the cells within the body do not respond to the insulin, so the tissues basically do not use the insulin in a correct way during the glucose metabolism. Insulin resistance can occur in either of the forms of PCOS. Even if the body fat percent is low in the people with PCOS, they can have high blood insulin levels, which is called as hyperinsulinemia, and insulin resistance occurs. And there is a strong association between insulin resistance and PCOS, which is clearly seen in this picture. See, as and when you eat the food which is rich in carbohydrates, insulin is produced to convert that carbohydrate into the energy. Now, the cells are resistant to the insulin, means the cells are not reactive to the insulin. So basically, the glucose isn't absorbed. So your blood sugar level rises. So that's one thing. Now, when your blood sugar level rises, so to balance that, more sugar gets absorbed, or rather it is stored in the form of fat in your body. And as it is stored in the form of fat in your body at that particular moment, you do not get that energy or you do not get that sugar that is required by the body, and hence you feel lethargy. Insulin resistance is a very common feature of PCOS, which affects almost 50 to 70% of women. So there are a lot of factors which occurs when we talk about insulin resistance. Because of the obesity, insulin resistance would be there. Because of the inactive or physical inactivity, obesity and physical inactivity both are one of the major factors which leads to insulin resistance. Then it might be aging, because as and when you age, your metabolism decreases. There are genetics which are involved in insulin resistance. There are certain medications and certain rare disorders as well which can lead to insulin resistance, and ultimately insulin resistance can lead to a lot of complications, as we were talking about type 2 DM, atherosclerosis, dyslipidemia and hypertension. And when we are talking specifically about PCOS and insulin resistance, they are literally linked with each other. There are various signs and symptoms of insulin resistance: hyperpigmentation, acne, skin blackening, skin pigmentation, skin tags, craving of sweets post meal, specifically when we talk about hair loss, then belly fat, tiredness after meals, weight gain, decrease in the muscle tone, increase in the fat percentage, and one of the most important feature or the marker of insulin resistance is acanthosis nigricans, which you can easily see visually on the neck areas or the groin areas of the individual. As you can rightly see in the picture, there's a darkening of this particular area. It's not because of any skin tanning or something like that, but it is a marker or a feature of insulin resistance. Another important aspect when we talk about PCOS is when we link PCOS with obesity, or when we link PCOS with the fat percentage in the body. When we talk about the lean PCOS, BCA, that's the body composition analysis, becomes the most important aspect to understand for PCOS. Here in the picture, we can clearly see that there are two individuals having the same height, same weight, same BMI, that's the body mass index, which we usually calculate from height and weight. What is the difference between both of them? Why do they look so much different? The main reason is they look so much different because of the body fat and the muscle proportion. So, not only just BMI, BMI is a marker which is utilized or which is used for understanding that that person falls in which category, whether healthy, whether obese, whether obesity grade 1, 2, 3, overweight. But now more significantly, more importantly, rather than BMI, BCA should be focused upon, which is body composition analysis, which shows how much fat percentage is there in your body, how much muscle percentage is there in your body, how much water is there in your body, because that affects your overall health. If you can see in this picture, both the patients or both the person are having the same weight, but they look very different because the person on the left is having more muscle mass, means he's on a more healthier scale, versus the one on the right side has more fat percentage, so he is more on the unhealthier side. Now when we talk about PCOS, when we talk about obesity related to PCOS, as I said, they both are very interlinked. This becomes very important to focus on reducing the fat percentage in the body and not just focusing on the weighing scale. You should be eating to fuel your body and nourishing your body and not your emotions. Now, have this become your concern, that how do I manage my PCOS? How do I live a happy, healthy life without all the chaos of those irregular periods, getting a lot of acne, those disturbed sleep, those hormonal imbalance, those mood swings? So, here is the solution. Let me tell you that. It is very easy to balance all the disturbances that usually happens during PCOS if we look PCOS and the management of PCOS in a holistic way, because only one thing, that is either the diet, or only one thing, that's either the exercise or your diet, that will not help you with the PCOS, but it has to be treated, it has to be taken into consideration or managed by a holistic way. There are pillars for management of PCOS. The three main pillars which help manage PCOS are shown in the list. Basically, diet management, activity management, and stress management. When we talk about diet management, it includes a balanced meal or a balanced diet along with some smart supplements which are required for the body. When we talk about activity management, it includes the cardio and other weight training activities which are required for increasing the muscle tone and reducing the body fat percentage. And when we talk about the stress management, that includes meditation, yoga, and other stress management activities, like something which you are really keen about or interested about. The management of PCOS can be best done by changing the so-called lifestyle. So it is actually not PCOS management, but it is lifestyle management. Now, when we talk about lifestyle management or lifestyle modification, what does that actually mean? It means you need to change your basic lifestyle to a lifestyle which you can sustain for your entire life and stay healthy and happy. Now, when we talk about the first most important thing when we talk about the lifestyle modification, that is your diet. It means you need to have a balanced diet which has all the food groups in the particular required quantity according to the requirements of an individual, and which is tailor made for a particular person. Remember, one diet doesn't fit all the sizes, or one diet doesn't fit all. As you tailor your clothes, as you get your clothes individually customized, same way your diet has to be customized, which includes all the food groups, which is balanced, which is according to your requirements, and with a dash of certain vitamins and minerals in the form of supplementation, which is required for your body. Second, when we talk about the stress management or the mood swings that usually happens due to a lot of hormonal changes and imbalance that happens in PCOS, it becomes very important for you to calm your mind, to make your mood swings little lesser, and also you should be knowing how to manage your mood swings. This can happen by doing yoga, this can happen by doing meditation, and also one more trick or tip that you can follow is you can involve into activity which you feel you want to do or you are interested in. For example, just reading a book, having some me time, dancing to the tunes, or maybe writing something, or maybe cooking, or XYZ, right? Next, when we talk about uh, management of lifestyle, management of PCOS, physical activity. Physical activity plays an important role in PCOS, or you can say in maintaining a proper weight and proper BCA, right? When we talk about physical activity, it's the combination of cardio exercise plus the weight training. The reason being, weight training will definitely help you to increase your muscle mass and reduce your fat percentage in the body, right? And cardiovascular activities or cardio exercises are required to keep your heart strong, to keep your blood circulation, your lungs strong and healthy. Next very important aspect which people always forget is adequate sleep. When I talk about adequate sleep, it does not mean sleeping 10 to 12 hours a day, but adequate sleep usually means a proper sound sleep, which is important for your body when you follow the circadian rhythm of your body, for your body to heal from within. It's very important because usually in today's era, what is our general practices? After dinner, we are all busy with our phones, our gadgets, our Netflix, our Hotstar, and lying down on the bed doesn't mean you are sleeping. Sleeping is actually sleeping, cutting down on every individual aspect which harms your sleep. As I said, a lot of use of gadgets and a lot of other things, maybe your thought process, maybe your mood swings, everything has to be calmed down at the time of sleeping, and a good adequate sound sleep or quality sleep is very important. Next, when we talk about maintaining weight, all of these factors would definitely help you to weigh properly or have a good PCA to maintain the insulin resistance, to decrease that and increase the insulin sensitivity, and to manage your PCOS symptoms and signs more better. Next, it is very important for a PCOS women or person to kind of quit smoking and alcohol, because ultimately we all know that they are not good for our health. So these modifications, these lifestyle changes are very much important. So one at a time, you can definitely start doing, those sort of lifestyle modifications which you can sustain for a longer period of time for a healthy and a better living with PCOS. Now, what is this game of calories? When we talk about reducing the weight, reducing the fat percentage in the body, lowering the waist hip ratio, how does that actually work? Or, how you can do that actually, right? So, as I said, that it is very important to work holistically when you talk about PCOS and maintaining the weight as well. It is very important for you to watch on how much calories you are taking in versus how much is your calorie expenditure. Of course, your clinical dietitian whom you are associated with would be working on this. So basically your calories intake, if it is less than your caloric expenditure, you will definitely tend to lose weight, and that lost weight would not be just your muscle weight or your water weight, but actually it will be your fat percentage that is reducing in the body. But if your caloric intake is more than your expenditure, you will tend to gain your weight. And that weight would be definitely the fat percentage or the fat weight. Because as we understood in the insulin resistance, how it actually works and how it helps, or how it rather ruins your whole system and increases the fat storage in your body. It becomes very difficult if you have more intake of calories than your expenditure. And there comes the role of physical activity, there comes the role of a balanced diet wherein your calorie input should be less than calorie output. So as I already mentioned that BCA nowadays is more important when we look up to maintaining a particular structure of the body. Rather, I would not say weight but particular structure of the body. It is very rightly said that don't weigh less, weigh better. As we have already seen that two people having the same height, weight, BMI, but having the different BCA, that changes their entire structure, that changes their health concept, or that changes their health status, right? So don't weigh less, weigh better. And don't eat less, it should be eat better. As the tag is there, that you don't need to put restrictions, but you need to know what you're eating. You have to do mindless eating, and you have to avoid mindless munching, right? So if you can see in the picture, both the food has the same amount of calories, but when we talk about the quality, the quantity, the amount of preservatives, the amount of processed options, the amount of coloring agents, salt, sugar, fat content, everything changes, right? So it is very important for you to understand how much to eat, why to eat, and when to eat, in what quantity. When we talk about a balanced diet or a balanced plate, there are important nutrients which we need to focus on, whether we talk about the macronutrients or the micronutrients: proteins, fats, complex carbohydrates, water, omega-3 fatty acids, vitamin D. These becomes very important or very crucial because they play an important role in immune regulation, insulin sensitivity, ovulation. It basically also improves the excessive oxidative stress that happens. So basically it helps to improve all of those, which is caused by the folliculogenesis, means the extra follicle that develops, and hyperinsulinemia in PCOS. It also helps to reduce the inflammation and the pro-inflammatory cytokines. Now, when we talk about carbohydrates, a low carbohydrate diet works wonders in women with PCOS. Remember, it's a low carbohydrate and not a no carbohydrate diet. Okay, choose foods that are low in glycemic index, means those foods which would not spike up your sugar levels in the blood. Eat more of the complex carbs like whole grains, cereals, millets, and avoid the simple carbohydrates or the simple sugars completely, like your fruit juices, your colas, sherbets, sugars, sugar canes, honey, jaggery, your soft drinks, jams, jellies, jams, jellies, and your soft drinks, which are loaded with lot of simple sugars and which harms your body in this way or that way, because excess sugars, when it is not utilized in the body properly, it gets converted into fat, as we already have seen. Next comes proteins. We all know that proteins are very important when it comes to balancing our meal, because proteins are very much helpful in weight control. It helps to build the muscles, which obviously burns more calories. Proteins should be included in each meal. The usual recommendation for proteins would be zero point 0.8 to 1 gram per kg body weight of proteins. You can always include the low fat dairy products, the lean proteins, what we talk about, the plant proteins, and also when we talk about the non-vegetarian sources of protein, chicken or the oily fish can be included. There are good source of proteins in terms of our dals and pulses, has to be included in the each meal in some or the other form. When we talk about fats, remember all fats are not bad, and fats are not making you fat, but it is the overall quantity, quality, and the consumption of the calories that you put in your body matters a lot. When we talk about fats, you have to avoid the saturated fats or the trans fat, which usually comes in form of your packeted products or the processed foods, the fried foods that you get in the market, all your chips to your chavanas and other things, and also your cheese, butter, other deep fried products, bakery products, which are loaded with trans fat, which are loaded with saturated fats. These should be avoided. Rather, you should be including a good amount of PUFA. And because omega-3 fatty acid is very important in reducing the inflammation, which is one of the important aspects to be considered when we talk about management of PCOS. So good fats would include your nuts, avocado, the seeds that you get in the market when you talk about pumpkin seeds, sunflower seeds, or the watermelon seeds, flax seeds, extra virgin olive oil, and a lot more to add to the list. Now there are certain natural superfoods which becomes an important part of the PCOS diet plan. For example, turmeric. It basically helps to reduce the blood levels of testosterone. In addition to that, it also causes a significant increase in the levels of estrogen. It also has an anti-inflammatory properties which helps in a person with PCOS. When we talk about cinnamon, there are different flavonoids and polyphenols isolated from cinnamon, having the free radical scavenging activities and antioxidant activities. Consuming just 1.5 grams of cinnamon, that is just 1/4 of the teaspoon, for 12 weeks improves the menstrual regularity in women with PCOS. It also helps to increase the insulin sensitivity. It makes your insulin more sensitive, and your cells would react to those insulin, and in a way that will obviously help to maintain your blood sugar levels. It will not allow your sugar levels to spike up. It enhances the activity of chromium, which again helps to increase the insulin sensitivity. So it basically acts like a catalyst. So if at all you incorporate 1/4 teaspoon of cinnamon powder every single morning in your diet, first thing in the morning when you wake up, it definitely helps and works wonders in improving the metabolism, improving the insulin sensitivity, and ultimately our goals to manage PCOS. When we talk about methi seeds or fenugreek, it also helps to improve the insulin sensitivity. It is rich in fiber. It reduces the glucose absorption in the intestine. It delays the gastric emptying and prevents the rapid sugar spike that happens usually post meals. It helps in improving the menstrual cycles, and it also improves on the chances of pregnancy or pregnancy rates. Right? You can soak 1 teaspoon of methi seeds at night, and then you can have that water and the methi seeds. You have to chew the methi seeds, and you have to drink that water, and that will really help you curb down on your sugar spikes. Here comes the most important picture of the slides. That is a balanced meal, or you can say a balanced plate method. This is how exactly your plate should look like when you are incorporating healthy food in your day-to-day routine. Basically, balanced plate usually provides a visual framework for the types of food to be included in the daily routine. It includes all the food groups, starting from your milk and milk products to your cereals, pulses, fruits and vegetables, your healthy fats, oils, water, and even your seeds, right? And this basically fulfills the nutritional requirements of an individual, which will definitely lead you to less hunger pangs or more satiety, more energy, because they would be nutrient dense. You have a whole plate which would be a nutrient dense plate, which would be balanced with all the food groups, balanced with all the nutrients that is important for your body. Balanced meals are basically rich in heart healthy carbs, good fibers, lean proteins, and a bunch of vitamins and minerals to add to it. As you can see, my 3/4 portion or the plate is covered with fruits and vegetables, which gives me a good amount of fibers when we talk about including that in your day-to-day routine. Uh, 1/4 is my lean proteins, all the sort of vegetarian and the non-vegetarian protein sources which are important. And 1/4 of it is the carbohydrates as we discussed. It should be mostly the complex carbohydrates which are included in the daily routine, right? So for example, if you are taking normal, say, roti sabzi, dal and a portion of salad, right? So your everyday should look like either you have roti, either you have rice. So rice and roti to basically give you that carbohydrate portion, a portion of dal or pulses to give you that protein, a bowl of curd side to it, and vegetable, that's the green vegetable that you usually prepare or cook, and a portion of fiber, that's the raw vegetables in form of salads. That is how your balanced plate should look like every single day. Even if you are going on for a quick meal, then there is this a small tip for that. What you can do is you can go for a wholesome meal wherein you can prepare you can say maybe a burrito bowl or a balanced bowl which has all the food groups included. Not necessary you need to make roti sabzi dal or rice sabzi and dal every single day. You can always be very creative when you plan your own meals. After understanding that how it is important for you to have a balanced meal, how it is important for you to do regular physical activities, stress management activities, adequate sleep, and maintaining a good BCA, this one concept of seed cycling is very important for the hormonal imbalance that keeps on going on in the body of a PCOS person. This is basically eating a specific seeds at the specific times. These little seeds support your body by binding and eliminating the excess hormones while increasing any hormones you are deficient in. These seeds basically contains nutrients that our body needs to balance our hormonal productions. The four seeds which are basically used in seed cycling are flax seeds, pumpkin seeds, sesame seeds and sunflower seeds. So basically, how do you utilize these seeds? From day 1 to 14, you have to use a combination of pumpkin seeds and flax seeds. And from day 14th to 28, you have to use sesame seeds and sunflower seeds combination. The first of 14 days, it is basically considered as your follicular phase, the new moon to full moon phase, which is menstruation and ovulation, and the 14 to 28 days is called as the luteal phase, ovulation to menstruation, that is full moon to new moon. Flakes and pumpkin seeds basically help to support your body during the estrogen dominant time of the month. Both are rich in omega-3s. Flax seeds basically is rich in phytoestrogens called lignans, which blocks the excess estrogens. The sesame seeds and sunflower seeds basically are rich in omega-6 and zinc, which stimulates the production of progesterone and regulates the hormones. Sunflower basically is high in selenium, which also helps in liver detoxification and thyroid hormone conversion. The follicular phase basically starts, as I said, it starts from the first day of your periods and ends with the ovulation. Cycle mostly is running on the estrogen. In order to ovulate, we need progesterone to kick in, right? In the luteal phase, basically, which begins at the ovulation and lasts through the end of your cycle, right? So this is the way how you have to manage 1 tablespoon of pumpkin seeds and flax seeds, each 1 tablespoon during the first to 14 days, and after 14 to 28 days, 1 tablespoon of sesame seeds and sunflower seeds have to be consumed. These seeds basically have amazing benefits when it comes to the hormonal balance. When we talk about the smart supplementations, along with the multivitamins or vitamins and minerals that you usually take from your food, and also the vitamin supplements that you are being prescribed, one of the vitamin, that is vitamin D, it becomes very important. The concentration of vitamin D usually is very less in PCOS patients. They suffer from vitamin D deficiency, and we all know that vitamin D deficiency is associated with a lot of problems when it comes to calcium absorption or even hair loss. Association of vitamin D deficiency with insulin resistance, metabolic and hormonal disturbances in PCOS and obesity is very common. Vitamin D basically can have anti-inflammatory response, which is actually required in PCOS. So it is very important, along with your antioxidants and along with the other vitamins. Vitamin D supplementation or the levels should be at least checked and then decided upon the amount of supplementation which is required, right? We all know that PCOS in today's era has become very common because of the erratic lifestyle that we follow. The usage of gadgets, our physical activity has decreased, our eating patterns, the consumption of processed foods, the consumption of packaged products, lack of sleep, a lot of stress, a lot of mood swings, a lot of other problems associated with all of these. It becomes very crucial for all the young girls, for all the young women to take care of their hormonal balance that is required for the overall well-being of a woman, right? So with this, I am very happy that I got this platform to share my inputs on PCOS and how we can easily manage the symptoms, easily manage the various aspects associated with PCOS, and how we can reduce on the complications of the PCOS. For all the women struggling out there with PCOS, you are a strong woman, you are with a great strength. So be proud of yourself and help yourself. Take the medical advice, take the diet consultation from a qualified individual, and get yourself cured, get yourself away from all the problems that you have associated with PCOS. I hope this presentation would be very useful for you to encourage yourself to take a step forward and manage your PCOS in a holistic way by taking the proper guidance. Thank you so much, guys.